Today we are discussing emerging drug trends on kratom overdose and emergency department visits in Tennessee. Next slide. Our speaker today is Jessica Korona. She is an epidemiologist here at the Tennessee Department of Health in our Office of Informatics and Analytics. Her work has focused on drug overdose surveillance and data linkage initiatives aimed to improving public health response and outcomes. She holds a master's of public health and epidemiology from Emory University. Her research interests center on health service research, particularly how surveillance data and data integration can be leveraged to identify gaps in healthcare access and inform harm reduction strategies for substance use and misuse. So I'd love everyone to give Jessica a warm welcome. And Jessica, I'll hand it over to you to take over.
Perfect. Okay. Yeah, well, hi, everyone. I'm excited to be here and talk about what our office has learned about Kratom. So I work in the Office of Informatics and Analytics, and we do a lot of the drug overdose surveillance for statewide trends in Tennessee. And recently we did a deep dive into Kratom and looked at fatal, non-fatal, and then just emergency department visit trends in Tennessee and have a brief report that's on our website. And there's a QR code for that at the end of this presentation. Next slide, please. So it's just the agenda, what I'll go over. I'll talk about what Kratom is, some of the Kratom legislation that's occurred recently in Tennessee, emergency department visit trends involving Kratom in Tennessee, and then talk about some fatal overdoses that have involved Kratom. Next slide. Okay, so starting very basic, what is Kratom? Kratom is a tropical tree that is native to Southeast Asia. So there's the picture of what the plant looks like. And this has been used over the years, just traditionally in that area of the world. The kratom leaf contains two main ingredients, so mitragynine and 7-hydroxymitragynine, or 7-OH. Both of these compounds occur naturally in the plant or in a lot of the, I guess, capsules or extracts that people are ingesting. More recently, the 7-OH part has been synthetically enhanced, which has caused an increased potency for kratom in a lot of the products. And that triggered the FDA to release alerts that kratom might be a substance of danger that we need to track more often over time. But kratom itself is often ingested orally in the form of tablets, capsules, or extracts, and the leaves are often dried or powdered and ingested as tea. So, next slide. So what does kratom feel like? Well, it depends on how much of the substance someone is ingesting. In small doses, kratom produces stimulant-like effects, which could include alertness or increased energy. But in larger doses, kratom produces more opioid-like effects, like sedating and calming effects. Kratom is not approved by the FDA for any medical use, but some people report using it just for the feeling it causes, to manage pain, to treat mental health conditions, and also to treat symptoms of opioid withdrawal. Next slide, please. So nationally, kratom legislation varies state by state. Some states have a ban on kratom, in other states it's legal, in other states it's just more controlled. Currently in Tennessee, adults over age 21 are able to buy kratom products. There's been a few different House bills that have been introduced this legislative term. One was Matthew Davenport's law, but House Bill 1647 and 1649 essentially tie criminal offenses related to kratom, label kratom as a controlled substance, and then invoke testing requirements for suspected fatal and non-fatal overdoses. So this would mean that any fatal drug overdoses would need to be tested for kratom, which is already happening. But then they also want non-fatal overdoses to be tested for kratom as well. So these are still making its way through the legislative session, and we'll see what happens whenever the final votes happen. Next slide, please. Okay, so now getting into the data. So what does the data in Tennessee tell us? So for this brief, we started getting a lot of data requests on kratom with the new legislative session approaching. So we got a lot of different data from fatal and non-fatal sources and compiled it all together in this brief report. We really wanted to focus on the emergency department visits involving kratom. We often get our best data from fatal overdoses, but we're not really able to tell too much about why someone might be using a substance. So with using non-fatal overdose data, we're able to get some more information about why someone went to the hospital, what symptoms they were having. So we decided to use the Tennessee Electronic Surveillance System for the early notification of community-based epidemics, or ESSENCE, to identify kratom-involved emergency department visits occurring in Tennessee hospitals from 2019 through 2025. So we identified these visits by searching for kratom and related terms like metragenine in the patient chief complaint field and provider triage notes. So we would identify a visit just if kratom was brought up at all in any of these notes. And then we first just looked at different categories of kratom overdoses. We tried to use coding using SAF software just to break down these visit categories into a suspected non-fatal overdose or maybe a side effect visit. And we shared a preliminary draft with Amber and Rebecca, and they gave us really great feedback, asking really good questions. And we went back to our data and really felt that we needed to do a deeper dive and have a better understanding of what these visit categories were that statistical software was not able to do on its own. So we divided all of these kratom visits among team members, and we used REDCap to code visit categories, symptoms, and reasons for use, and which gives us a better understanding of why people are going to the emergency department in Tennessee for kratom. So next slide, please. So now we'll go into the data from these emergency department visits. And this first slide shows the number of emergency department visits where kratom was mentioned from 2019 through 2025. Overall, we identified 414 emergency department visits where kratom was identified. This number has increased over time, particularly between 2024 and 2025, where we saw a doubling in the emergency department visits for kratom. And then the next few slides will go over why people are going to the emergency department. So next slide. On this slide, we can see reasons for people going to the emergency department for kratom. The top reason over the 6-year period was for side effects, then for withdrawal symptoms, then mental health events, and then the overdose category. So suspected non-fatal overdoses were a relatively low number overall. Then we had an injury category. So this would be a car accident or if someone fell and mentioned that they had taken kratom. And then drug screens. So interestingly, in some of the notes, people were going to the emergency department for drug screens, either for their job or for trying to get into a treatment program. Next slide, please. So then this slide shows those symptom categories over the 6-year period, and you can see that there's some changes. So all of these categories or visit types did experience an increase over the years, but particularly between 2024 and 2025, we saw some differences in the patterns of these categories. So side effects are the most common over the 6-year period, but then between 2024 and 2025, we saw a shift and an increase in people going to the emergency department for withdrawal symptoms. And then we saw an increase in suspected overdose events as well between 2024 and 2025. And then these next slides will go deeper into what some of these categories are and what each of these look like. So next slide, please. Okay, so first starting at side effects, since it was the most frequently cited category, this was really wide ranging. We saw a lot of different symptoms that people reported. They just didn't feel right and wanted to come to the emergency department. The most common was a tie between mental health or behavioral health symptoms and neurological symptoms. So mental health symptoms included anxiety or panic attacks, hallucinations, suicidal or homicidal ideations. Then for neurological symptoms, we saw dizziness, tremors or shaking, seizures, drowsiness, headaches. We also had a fair amount of gastrointestinal symptoms, so nausea or vomiting, abdominal pain, constipation or diarrhea. And we saw heart-related symptoms as well. This included chest pain or abnormal heart rates. And we also had a number of people coming in for shortness of breath or shallow breathing. And then some people just came in for general pain. Next slide, please. Then moving to the withdrawal categories, this was the second most frequently cited reason people were going to the emergency department. Within that category, 66.7% of the visits that were mentioning withdrawal symptoms were for withdrawal from kratom alone. That was the only substance the person mentioned. And then the other 33.3% were visits that included symptoms from multiple substances. So this could include kratom along with other substances that they were taking. And the symptoms for this category really range. So some symptoms were nausea or vomiting, abdominal pain, anxiety or panic attacks, and then heart-related symptoms. This included chest pain, heart palpitations, and we also saw shaking and tremors as well. Next slide, please. So then moving into mental health related symptoms. So these were very wide ranging symptoms, a lot of different ranges of mental health conditions that someone might have been having at the time. But the most common reason people went to the emergency department with a mental health condition were for suicidal ideation or homicidal ideation. And that was surprising to our team and something that we'll be looking at more to see if we can find any more themes within those visit categories or see what might have been happening there. And then the other categories were anxiety or panic attack. A lot of visits just mentioned altered mental status, then hallucination or psychosis, agitation or irritability, and then depression and paranoia symptoms as well. Next slide, please. So then looking at the non-fatal overdose category, so this number was really low, only 43 emergency department visits over the 6-year period where someone was treated for a non-fatal overdose involving Kratom. And the notes, most people just admitted to taking too much Kratom to the healthcare provider and they were worried. Some people were found unresponsive, and other times the provider just documented a Kratom-involved overdose, toxicity, or poisoning. And then this box here is an excerpt from our report that goes into some of the symptoms from a kratom overdose. And this kind of aligns with how much of the substance the person might have been ingesting. So in lower quantities, there's stimulant-like effects. So some of the symptoms could be more similar to stimulant-like overdoses. So chest pain, high blood pressure, seizures or tremors. But then if someone ingested a higher amount of kratom, they could have more opioid-like overdose effects. So they could be found unconscious or unresponsive or have slow breathing. So just to keep that in mind that kratom overdoses can look different depending on how much of the substance someone ingested. Next slide, please. Okay, so then demographics of who is going to the emergency department for kratom-involved visits. When we looked at this, was really mirrored the overall trends of overdose across Tennessee. Most visits occurred among males, people who were white race, and then people aged 18 to 44 years of age. We did see some differing trends when we looked by ED visits by Grand Region. So interestingly, there were a higher proportion of visits in West Tennessee in the earlier years, and now West Tennessee makes up a lower proportion of emergency department visits. East Tennessee has fluctuated over time, and Middle Tennessee region has seen an increase over the 6-year period. But overall, in 2025, most visits were in Middle Tennessee, followed by East Tennessee, and then West Tennessee. So next slide, please. Okay, so that was information about people going to the emergency department for Kratom-involved visits. Now transitioning into fatal overdoses involving Kratom. So we've been tracking fatal overdoses involving Kratom for a number of years. We identified the first fatal overdose in 2016. And this slide shows data from our death certificate data. So this is where Kratom was listed as a cause of death on the death certificate. So trends for fatal overdoses involving Kratom, this has really changed over time. So since 2019, there's been about 2 to 3% of fatal overdoses that involve Kratom each year or where Kratom was listed as a cause of death. We saw a large increase between 2017 and 2021 in Kratom being mentioned on the death certificate. The numbers have since declined slightly, but overall, about 2 to 3% every year since 2019 have had Kratom as a cause of death on the death certificate. Now, these are usually deaths where multiple substances were involved in the death. So each year, there's only a few instances where Kratom is the only substance listed on the death certificate, but this has been less than 1% each year. So there are cases where Kratom is the only substance mentioned, but it is rare. Next slide, please. And then this map shows fatal overdoses involving Kratom by public health region for this 2016 to 2024 period. So when we look at the fatal overdoses, most of these deaths occurred in around Davidson County and then East Tennessee region. So similar to what we're seeing in the non-fatal overdose data. Next slide, please. Okay, so those were information from our death certificate data. We also have data from our state unintentional drug overdose reporting system, or SUDRS. So this data system has information on unintentional and undetermined manner of death overdoses, and we get toxicology information for these deaths and are able to abstract it into a different surveillance system. So this slide shows those toxicology results for where Kratom was present on toxicology between 2019 and 2024. So these numbers are a little different, but here you can see the actual substances that were present on toxicology. So over time, the number of deaths where kratom was on toxicology has increased, and then we did see a decrease in 2024, but the proportion is relatively similar. Between 3 to 4% of deaths in suitors had kratom listed on toxicology. When we look where kratom was the only substance on toxicology, that was very rare, around 1% of these deaths, 1 or 2 cases each year. Most of these deaths had fentanyl on toxicology as well. Methamphetamine and prescription opioids were also present. So were alcohol, benzodiazepines, and cocaine. So a lot of polysubstance and multiple drug uses occurring where kratom could be used along with fentanyl or methamphetamine or just taken at similar time periods as them. Next slide, please. Okay, so now that we look at the demographics of kratom-involved fatal overdoses, this is very similar to what we see in looking at the emergency department visits. So adults aged 25 to 44 continue to represent most of the kratom-involved deaths. Most of the decedents are white and male, and this is just consistent with broader overdose trends as well. Next slide, please. So then pulling this all together, the main takeaways are that kratom emergency department visits have risen sharply between 2024 and 2025, but there remain a small proportion of overall drug-related emergency department visits. Most kratom-involved deaths include other substances, especially fentanyl and methamphetamine, and emergency department visits linked to kratom are not limited to overdose. Most visits are related to side effects or withdrawal symptoms, mental health conditions, we need to take more time to dive into all those categories and try to get a better understanding of that. But a lot of really good information from our emergency department visits. And then ending, the overdose surveillance program will continue to track kratom-related emergency department visits and fatal overdoses, especially as increasing levels of 7-OH may have the potential for more health risks. And then a limitation to note for testing of these substances, a lot of groups are working on increased toxicology testing, but right now we're really only able to tell if metragenine is present on toxicology, which would mean that kratom was present. But detecting 7-OH has been difficult, and currently our labs are not able to distinguish between those two substances. But the NMS Labs is working on creating a test for that. So we're hoping in the next few years we'll be able to distinguish and whether metragenine and 7-OH was present on toxicology, and then how much of each substance was present on toxicology. Next slide, please. Yeah, but that's all I had for today. I'm happy to answer any questions. And then here is a QR code for our emerging trends brief that's on our website.
Awesome. Thank you so much, Jessica. That was a lot of really great information. We appreciate all the work that you all do with this and responding to as these come out. And so just thank you for your time today. We'll open it up to questions, or are we doing the Menti next? Amber, sorry. Yeah, okay. Questions. So we have one in the chat to start, and then if you all have questions, you can do it in the chat. You can raise your hand or use the Menti. You can scan it there or go to the menti.com or the link that's pinned in the chat. But one of our first questions is, are there specific dosages differentiating the effects of stimulant or opioid effects, or is that just individual and case dependent?
That's a great question. I could not find anything that was solid evidence of that. It was interesting when I was going through all the published articles. No one really has a good sense of the prevalence of kratom use nationwide. There's a lot of studies in specific populations, but overall, there's not a lot of good broad evidence examining what kratom looks like and what the effects of the body are for a larger group of people. So definitely an under-researched area currently.
Thanks, Jessica. Any other questions for Jessica on kratom? Also, I'll add how we also metabolize different substances can also depend on how they affect us too. So, think about tolerance, how much people are using, and the systems used to it. our systems are used to it can also impact like that effect level as well. So it can be hard to know what the, those ranges could differ for each person. And the mentee's open now too. If you want to ask your question more anonymously, please feel free to ask questions while we have Jessica here to answer them. Well, as we're waiting for some questions to come in, I also have a question. How is it determined on the tox reports that the cause of death was kratom when we know that there's only like one or two that are kratom only involved, and when we see like the vast majority is, especially with fentanyl, like part of it as well, and other opioids?
Yeah, so we've asked the medical examiner's office and forensic pathologist this question, and it seems to be up to the forensic pathologist and what they find during the autopsy. We've seen varying levels of all substances on toxicology reports. So I think it's just a decision of up to what did the forensic pathologist find on the autopsy, what other medical conditions could have been linked to the death, and how could the drugs have interacted with those.
Hey, Brad.
Hey, you stated that I think it was 66 people went to the ED for withdrawal symptoms. Did they know they were having withdrawal symptoms when they went to the ED, or is that like were they so like naive to the opiate like withdrawal that they just like were having withdrawal symptoms, like I gotta go get this checked out, and they were told it was withdrawal symptoms?
Oh,
Because that
yeah.
makes a huge difference of like what we're dealing with, you know.
Yeah, that's a great question. I would say about half of the people acknowledged that they were trying to stop taking kratom or they had not taken kratom for a certain amount of time and then had these symptoms. And the other ones were just saying that they were maybe trying to get off of another substance and they were trying to use kratom to help with some of the withdrawal symptoms. So I think some people were aware, but I would say that others were not aware at all that these symptoms were tied to them not taking kratom recently.
Huh. Oh boy.
Thanks,
Lots
Brad.
of room for education.
Yeah. Any other questions with kratom? I'll end with one question if we don't get anything else. What, from your work in this and developing the brief and the research that you've all done and the data that you've seen, and probably the deep dive that you've done in those tox reports too, what is something you feel is maybe like a key takeaway from like the data brief or your presentation that you feel like is like a key message?
Mm. I think there needs to be more focus on the symptoms of taking kratom and just the overall health of people and maybe why they're turning to that. I think there's room for definitely more qualitative type interviews to see why someone started using kratom. Um, but for deaths, I think there's a low amount over year. People may just be taking it along with other substances. They might not know they're taking it, but for all the non-fatal overdoses, or not overdoses, but visits, it seemed like people were intentionally taking kratom. Some of them were taking it for specific symptoms to maybe self-medicate. Others were just taking it to see what would happen. But I think there's a need for more messaging about educating what kratom is, what it can do to you, that there could be side effects from taking the substance, and then trying to do deeper dives into seeing if all the mental health conditions were a result from someone taking kratom or if it was an existing condition that someone just really wasn't aware about and they were going to the emergency department confused about that.
Thank you. We do have another question. Is it imported or being grown here?
Oh, so I would say both. I know we got a request from farmers who are growing it in Tennessee when the legislation was going through. So I think it is being grown here. I'm not sure if it's being imported or not.
Well, thank you so much, Jessica. Everyone, please give Jessica a round of applause. We really appreciate your time here and the work that you do around emerging drug trends and overdose. We really appreciate you. I'm going to end the recording now.